Good morning, everyone, and happy Social Work Month. My name is Annette Johns, and I'm the Associate Director of Policy and Practice with the Newfoundland and Labrador College of Social Workers. I will be your moderator for today's education event, Homelessness and COVID-19, a Local Context. As social workers, we know that COVID-19 has greatly impacted the health and social well-being of individuals, families, and communities throughout our province. Today's webinar will focus on the impact that COVID-19 had on those who experience homelessness. The webinar presentation will be approximately 60 minutes, followed by a question and answer period that I will moderate. Please note that all the details you need, like how to access the slide deck and other housekeeping information, is in the housekeeping and announcement widget. All the widgets can be accessed by clicking the blue and white icons at the bottom of your window. You can also resize and move around any of the elements you see on your screen to customize your viewing experience. During the presentation, I encourage you to type in your questions using the question mark icon at any time, and I'll begin asking them at the end of the presentation. Please note that only the presenters and I can see the questions. I now want to introduce our speakers. Melanie Hickey and Christina Wakeham are both registered social workers here in Newfoundland and Labrador. Their full bios can be found in the bio widget on the webinar platform, but I do want to say a few words. Melanie is the Program Manager of Housing Services at Stella Circle, working out of the Brian Martin Housing Resource Centre here in St. John's. She has worked in the housing and homelessness sector in both Ontario and Newfoundland and Labrador, and in her role at Stella Circle, she provides leadership to the team at the centre, which helps people who are homeless or at risk of homelessness find and remain in safe, affordable, and stable housing. The team delivers a continuum of housing services, including counselling, advocacy, case management, and mental health intervention. Christina is the Program Manager of Naomi Centre, an emergency shelter for young women at Stella Circle, as part of its Real Homes division. Christina has worked in the housing and homelessness sector for many years and was previously a social worker with the Newfoundland and Labrador Housing Corporation before joining Naomi Centre this past January. This is an exciting new role for her as it brings her knowledge of housing and homelessness sector to the community and aligns with her passion for harm reduction. And on that note, I'm so pleased that Melanie and Christina are delivering this webinar for us today in celebration of Social Work Month, and I'm now going to pass the virtual podium over to them.
Good morning, everyone. This is Melanie Hickey. I would like to wish you all a very happy Social Work Month, and a major thanks to the NLCSW, the Newfoundland Labrador College of Social Workers, for giving us this opportunity this morning to talk to you all about our experiences this past 2 years in navigating COVID-19 within certainly our practice in housing at Stella Circle. To get us started, I would like to provide a little bit of context for those who may not be familiar with Stella Circle on who we are and what we do, because much of the the knowledge we'll draw from during the presentation will really focus around our practice here at Stella Circle in the last 2 years. So Stella Circle, we have 3 pillars: real homes, real help, and real work. Christina and I both work in housing services, which falls under our real homes pillar. As Annette mentioned, I am the program manager here at the Brian Martin Resource Centre. I've been here almost 13 years. Our resource center is located on Rollins Cross, diagonally across from the Hungry Heart Cafe. What's really unique about our service is we are the only drop-in housing resource center in the city. So we see a lot of drop-ins, a lot of service requests. We have a team of us here in various roles. We have case managers. We offer housing-focused intensive case management. We have a team of housing support workers, tenant relations specialists, or we have an occupational therapist who works out of this site, who's seconded with us from Eastern Health. We have 79 units of housing. So one piece that I'd really like to lift up during this presentation is certainly our experience in supporting 79 units of our own tenants during COVID-19. We offer housing help every day. Folks can drop in at any time. often folks are experiencing a housing crisis, but it could be certainly any reason for a service request. We have a resource center in which there are computers, telephones, internet access, whatever you need. And you can certainly avail of that at any time. Certainly, of course, in the last couple of weeks, we've seen again another increase in foot traffic to our resource center. We offer housing support services. So not only do we support our 79 tenants, we support a wide vast of individuals. We use the term participants for the clients we support here at Stella Circle, who live in the private housing market, and that might be through private landlords or through subsidized housing such as Newfoundland Labrador Housing, the City of St. John's nonprofit housing. We work very, very closely with the shelter system and the shelter roll call, which Christina's going to speak a little more to, because that's a system certainly Christina worked in a number of years with. We have one transitional housing unit, which is Jess's Place, which you'll see there on the slide. It's our only transitional unit at this time at Stella Circle. It's been unique in a way this past 2 years. We've had one tenant live in that unit, just in terms of adhering to COVID restrictions and everything. We've had a couple women live there, but one at a time, but we do have capacity. It's a 3-bedroom house. I'll let Christina speak to Naomi Centre shortly. She has a whole slide she's going to give you on that. Under our pillar of real help, you'll see our community support program, our Just Us Women's Centre, and Emmanuel House. I'll give you a quick little overview of that. So our Emmanuel House program is a residential counseling program that offers a supportive environment to adults experiencing a variety of challenges, mental health, addictions, and trauma, and those who are involved in the criminal justice systems. Participants can stay for, what we would say a multi-week period. That certainly varies, and they take part in individual and group counseling as well as life skills support. We certainly support a lot of individuals who are leaving not just Emmanuel House treatment program, but any form of programming where they may require housing upon exit of those programs. Our community support program is an intensive case management program that supports individuals with complex mental health needs who are living independently in the St. John's area. So the overall goal of that program is to help individuals improve their overall quality of life, and certainly to reduce the length and number of admissions to institutions, primarily hospital and the prison system. So services, again, are very unique and tailored to that individual. See a great demand, certainly, for that program, and for the case management and the housing support component, mental health and housing support component. Our Just Us Women's Centre, another unique program. One of the newer programs, the Brian Martin Housing Resource Center and the Just Us Women's Center, we were once in the one building. We all opened up together in 2009. I guess a fond memory of those who have been here since then is the Prince himself, Prince Charles and Camilla, unveiled this building, and it was a big event. They stayed across the street in the Rhine Mansion, and we all got to celebrate the opening, certainly the launch of the Brian Martin Housing Resource Center and Just Us. Just Us provides counseling, individual and group support to women over the age of 18 who have been in conflict with the law. They do a number of things: peer support, group services, addictions counseling, trauma groups, anger management groups, and certainly a huge role is helping women navigate housing and employment challenges and advocacy whenever required. The staff over there visit the Newfoundland Labrador Correctional Center for Women in Clarenville weekly, and they do some tremendous, impressive work in terms of individual and group counseling, assisting women with release planning into the community. And our final pillar I'll comment on is our real work. So that would include our employment counseling, our transitions groups, our adult basic education, work experience, and our social enterprise. So just to comment around the social enterprise piece, we have a couple in social enterprises. We have our Clean Start, that I just want to say was such an integral program from a COVID-19 perspective. Our COVID-19 cleaning services were in high demand and still are this past couple of years, doing, deep cleans and high touch, daily disinfection to areas, going out into businesses, helping businesses who are about to reopen again, and offices, to protect their staff and their, clientele. We also, you may know about our Hungry Heart Cafe, which is our restaurant located here on Rollins Cross. We offer in-house dining and catering, and we train individuals to work in the restaurant industry. And we also have our Home to Stay, which is one of our newer social enterprises, where we help individuals essentially age in place. So some of those things are small repairs, grab bars, handrails, widening of doorways, modifications, all sorts of things. So we've been very excited about that. Just to highlight some of the main things around our Real Work program. So that building is located at 135 Cabot Street. Anybody from St. John's might recall it as the old Teutons building. We believe here at Stella Circle, the best social program is a job, and meaningful work is certainly essential to every aspect of life, and certainly around housing. It's very interconnected. We offer a number of employment counseling and support transition groups, skills discovery, work orientation. We have a team of employment counselors and employment support workers. They're doing some humongous innovative things down there, and we see many referrals on a daily basis. Just to bring you to the next slide here. Next, there we go. So that is the Brian Martin Housing Resource Center. That's the building which our housing team, where I work out of. We are one of the largest suppliers of affordable housing in our sector, and our strategic plan, which was 2020 to 2025, we have the goal of increasing our housing stock from 79 units to 100 units by 2025. We believe, there's a great demand. People often come into our resource center and say, how do I get in your building? How can I live there? And, we've seen very little turnover in our buildings. We have a couple buildings down the street. We have Carew Lodge, which you might be familiar with. This building here, and across the street above the Hungry Heart Cafe, we also have a couple of more apartments, and we also have a few scattered sites. So I did want to say, if any of you are working with individuals who are requiring housing assistance, we accept referrals, self-referrals. Anyone can walk in, or just simply give me a call or call the main line. We help people with applications. We have a lot of folks come in saying, I'm facing an eviction. Where do I go from here? I don't understand my rights and responsibilities. I don't think what my landlord is asking of me is, the correct scenario. We do a lot of advocacy work for people when they're on wait lists for social housing. We, do see a lot of people come in who have absolutely nowhere to go, who might have been sleeping rough, who might need a referral to the shelter. So we work extremely closely with the Newfoundland Labrador Housing Emergency Shelter Line to get people into shelter, which I'm sure Christina is going to elaborate a little bit further on when it gets to her piece there. So we believe in a housing first approach. It is completely essential to have housing to work on any goal and aspect of your life. And we'll elaborate on this shortly, but certainly during a worldwide pandemic, it has certainly lifted up how essential housing is to the health and well-being of our communities. And Naomi Centre, Christina.
All right, I'll take it over here. So Naomi Centre, this is, I guess, a picture of the building. We're located on Patrick Street, 4 Patrick Street. Naomi Centre was one of, I guess, the original programs that had started under the Stella Circle umbrella. And It was known previously as Patrick House before becoming Naomi Centre. It is the province's only emergency shelter for young women that's targeted specifically for women. And we do work here from a harm reduction model. The work looks different depending on who comes in and what kind of needs they're presenting with. And the ages vary anywhere from 16 to 30, and our average age of stay varies depending on the guests that are here. Currently, our average age is around 30 or 23 years old, sorry. People come here when they're in need of emergency housing. We have 8 beds in house, and they are all single. I guess one of the things that happened, we did have a shared space here at Naomi Centre to where folks would share a room. So with some COVID changes, we've actually renovated all of our spaces. Now they're all single rooms, and we do have 8 of those. We also connect with the Brian Martin with some housing for the folks that live at Naomi Centre. So we provide support to women who've transitioned out to housing within the Real Home program that are connected and fit the mandate of Naomi Centre. We also provide outreach support and support to former residents. We do a resident meal, and we provide harm reduction supplies and also do some of that landlord mediation and diversion work with folks when they're calling us in core housing need or in crisis, trying to figure out what supports or where to kind of go when landlords are giving them notices or requests, or any other type of needs that might come up for them around healthcare. So doing some system navigation, trying to help them connect and plug into the system where they're looking for services too. So we do some work around that as well. I think that's all that I have there for Naomi. In order to access Naomi, you can get referred to Naomi through a self-referral. The emergency housing system with Newfoundland and Labrador Housing also will make referrals to Naomi Centre. Sometimes we'll be getting referrals from youth services workers. So there's a variety of ways. Sometimes women just show up on our doorstep. So we kind of meet women where they are and get referrals from various different referral sources and from all over the province. So people do come, or women do come here from outside of the St. John's area when they're in need of shelter. And this is the place that they're kind of looking for.
Oops. So essentially our overview of today, we simply want to tell you all about our experiences and learnings working with some of the most vulnerable community members who are experiencing homelessness. It has been an interesting 2 years, to say the least, in terms of the visibility of homelessness in our community, certainly in the downtown core of St. John's. We have worked so closely with the shelters. So we just want to share with you, I guess, some of our perspectives and learnings, what we've observed, and I guess some takeaways that we might even use beyond a pandemic world, a shift in how maybe we'll even offer some services. And I guess it really lifted up as well some of the things we've done that we want to keep doing. So we will get to that.
So before we look at the local context, we're going to look at the Canadian context of homelessness. At any given night, as this slide indicates, there's 35,000 people that could be experiencing homelessness. And throughout the year, that number increases. I guess COVID for us has really lifted up the importance of finding stable, affordable housing and that housing first model, as Melanie had alluded to earlier. We're asking people to shelter and to stay in place, which is very difficult for folks, I guess, who are experiencing homelessness and don't have a shelter to stay in. So from a Canadian perspective, there are 235 Canadians experiencing homelessness within the year. And I guess something that COVID has also highlighted is those folks that are in the core housing need. So there's a lot of folks that are out there, while they're not homeless yet, they're at a high risk of ending up homeless because of issues like poverty, the affordability of housing. And I know on the media, there's a lot around different big cities, but even locally, we've seen the rental market and the demand for housing shifting, and what that means for folks that are of the lower income. So folks come into housing in various different ways. I guess there's three main ways that they could come in, and one is around the structural things that are going on. And when we think about structural things, we think about the lack of adequate income, the lack of access to affordable housing, the access to the health supports people need, and some experiences of discrimination. So those are the things we would see as structural pathways where folks come in through the homeless housing and homeless sector. Another, I guess, key area where we see folks a pathway into the housing and homeless sector is folks coming in through system failure. So that's we see this here at Naomi with youth who are transitioning from the child youth and family services system into the adult system, and sometimes those transitions don't go very smoothly, and homelessness becomes a result as those when those transition plans fall apart or they're not implemented the way they were intended. Or sometimes there's inadequate discharges from like correctional facilities, hospitals, addictions facilities, those type of things. Some other system failures we'll see that can lead to homelessness is around immigration and refugees coming here, and when there's not the supports and programs in place to kind of meet the needs of that population who are trying to navigate within the housing system and find housing, safe and stable, affordable housing. And the last factor is around the individual relationship factors. And this could be a variety of different things, from like any traumatic event, personal health issues, mental health, addictions. Sometimes it's physical health issues that ends up people aren't able to stay in their homes for those reasons. Problems with relationships, so intimate partner violence, some family conflict, those type of things. It's important to note, though, when we talk about the various pathways to homelessness, folks usually don't end up homeless based on one thing. It's usually a combination of several things that are going on. So they may have experiences around difficult transitions and trauma, and also have some of the youth we see have limited access to affordable housing based on their income, and then the discrimination around their age about landlords are less willing to rent to that younger population than they are to like the adults or even like people who are in the university ages. So the 16 to like 18-year-olds, they really struggle with trying to find housing in the regular housing market to kind of meet their needs. And as a result, they often end up in shared housing arrangements or bed-sitter arrangements because they're not able to get their needs met in that way. So this is just a bit of context about how folks end up in the housing and homeless system. Again, I just want to reiterate that it's not usually one thing that kind of gets somebody access to the housing and homeless. So usually there's a multitude of things that are going on that impacts them to end up into a homeless shelter or a need of housing support because of some instability issues in housing.
Certainly, we've observed during the last 2 years that people experiencing homelessness have definitely been impacted inequitably by COVID-19 due to their, increased exposure to the virus, or risk of exposure to the virus, vulnerability, and any various, medical comorbidities. We have observed certainly a profound impacts it's had on people experiencing homelessness, and particularly on their mental health. We know that a vast percentage of folks who are in an emergency shelter setting experience a multitude of mental health and mental illness. For some, it might even precede their homelessness, and for others, it might have worsened. For anybody, homeless or not, during that experience of COVID-19 alone, but also coupled with being, with no place to go, no home to call their own. In the pandemic, most people have experienced ongoing and certainly varying degrees of effects on, their mental health. And we know that the longer an individual is homeless, the greater any pre-existing health condition will worsen or can be left untreated. I guess also of important note I'd like to make here is that, people experiencing homelessness often have underlying respiratory illnesses or conditions. In my 13 years at Stella Circle, I've become particularly interested in the number of folks who come through our doors who have diagnoses of chronic, COPD. And it might even worsen or go untreated during that experience of homelessness. So as you can imagine, this would make for COVID screening even more challenging. And when people are coming in, to access services, you're balancing that, screening, doing the COVID lens screening, but also keeping in mind the person could definitely, have been exposed to the virus. Early on in the pandemic, it was certainly made clear that the impact of COVID-19, like many other health crises, would not be felt equally amongst certainly the population that we work with here at Stella Circle. And certainly the varying ways in which people have been exposed to the virus and the overall susceptibility. We've worked very closely with the medical system, which I'll talk about a little later, but certainly the harm reduction and team of nurses and the Downtown Healthcare Collaborative. We helped many people, get medical attention, virtual medical appointments. We will speak to that a little later around some of the more concrete work we did. But I guess just to lift up that the pandemic has certainly highlighted that housing is a social determinant of health. In order to be well, you need to be housed. And that was one of our, that was a big, that just really lifted up during this whole experience.
And I guess too, when we think about housing, housing first, it isn't just about providing people the roof over their head. Housing first is really about providing people immediate access to housing, but also providing people access to the support so that they can maintain that housing, whatever that might look like, whether that's mental health supports, different supports in terms of home supports and various different types of connections they might need so that they can remain stably housed. And COVID-19 really lifted up, I guess, the work that those wraparound supports were doing from an eviction prevention lens. When things started closing down, people started not being able to access services as they typically did. This was very evident, especially with the folks who were at risk of homelessness and even put them at higher risks of ending up in the shelter system. A lot of the spaces where they would go to kind of get their daily socialization needs and to like connect around social inclusion and mental health and even some of their healthcare needs led them to be really disconnected and isolated, which, as Melanie alluded to in the previous slide, we saw a deterioration in their mental health and sometimes physical health, depending on what needs were going unmet. As you know, like the healthcare system and what they were able to provide also shifted, which impacted the vulnerability of the people who were at the cost of either coming into the homeless system or already in the homeless system. As Melanie had just alluded, there are at higher heightened risk around mental health and physical health needs. And sometimes those things were going unaddressed during COVID and resulting in issues that impacted their housing. One other thing that became really evident around the COVID-19 experience, and specifically the folks who were precariously housed or persons living in, within the homeless system, the contact tracing, as Melanie mentioned, even the screening and the things that we would do typically were more challenging for this population. they're so transient and rely on each other for social supports. It was really hard sometimes to know who they were in contact. Sometimes they didn't even know their name and those type of things. So it was interesting to try and follow the public health guidelines and protocols within this population who operated in a different way, particularly when services started to shut down. And also to, as I alluded in the pathways to homelessness, some of the folks that we work with who are within the homelessness serving system have had a lot of distrust and experiences with other systems, whether that's the child protection system, the justice system, the mental health system, the healthcare system. So there was a lot of barriers there in trying to get buy-in and having conversations and meeting people where they were around what the changes were with the public health guidelines and why we needed to adhere to the protocols and those type of things. So really working with people to get beyond some of those barriers around the distrust that they have within the system and helping work with them to kind of understand and be able to adhere to the public health guidelines as best they could, given the circumstances they were in. Just to move on to the next slide here, also a lot of the folks who were experiencing homelessness also didn't have the same type of employment where you could get access to the Canadian Housing Benefit or the CERB. So their employment, because of the changes in shutdowns and those types of things, a lot of the folks that we were working with were in more non-traditional types of work, maybe panhandling, doing sex work, or working odd jobs under the table. So for these reasons, the pandemic had a significant impact on their income, and their access to secure income in different ways was also impacted. Also during COVID-19, especially in the beginning of the pandemic, where folks didn't really know what was going on and how to best respond, and there was a lot of concerns with folks living in shared spaces and conjugal settings like they are in the shelters or other types of precarious housing. Their ability to physical distance, engage with different activities were impacted, and we were also helping people to kind of shelter in place. So when people would call for support around housing, because there was risk factors with them coming into these conjugal settings, there was a lot of work done with folks to try and get them to shelter in place. And a lot of people wanted to shelter in place. They didn't want to come into these congregate settings because of the concerns of shared spaces and not knowing, and that they have their own vulnerabilities and chronic health issues and wondering on how that would impact them. So we saw, especially at the beginning, people who were in situations of precarious housing or in relationships that were intimate partner violence was going on and those type of things. It was really challenging for folks in those systems who were having those experiences to make decisions about what was the best response for them, given known that do they shelter in place with this partner who's has potential to become violent and they've had experience of violence around, or should they climb into a shelter system where they're now in a shared space and the heightened risk of COVID-19. So there was a lot of risk management and harm reduction that was happening in conversations that were happening with folks around what was the best pathway for them to shelter in place or to look for shelter somewhere else based on what was going on in their current circumstance. But we did see folks, especially from a gendered lens and gender diverse populations, at higher risks. And the intimate partner violence, as you can imagine, even folks that had difficult relationships and I guess wouldn't classify them as intimate partner violence, when we had to isolate and stay home, I mean, the potential for conflict just increased. So we did see a higher risk to that diverse population around intimate partner violence and also just in those precarious housing arrangements, because sometimes they were following all the protocols and health health guidelines, but they couldn't control what the other person in the bed sitter next to him were kind of doing, and we're really concerned about how that might impact them.
Thanks, Christina. Certainly many individuals experiencing homelessness, particularly in a COVID-19 context, the risk of experiencing criminalization definitely increases with that added vulnerability. It's been very difficult for people homeless to avoid infractions in a lot of ways from a criminal justice standpoint. Many clients who have been accessing our housing services, particularly during the pandemic, have expressed having, as Christina did touch on, having more conflict with shelter guests, neighbors, partners, roommates, and so on, particularly for people living in those communal congregate settings. Many reported increased usage of substances, higher and increased stress levels, conflicts with neighbors, and overall disruptions in neighborhoods. Many calls from landlords looking for support. One thing I did want to mention is we do immense work with landlords. Given that we consider landlords a part of our team, it's a partnership. Many landlords contacting us during the pandemic to say, I need some help, getting into my property. There's been a lot of guest management issues, and I think, gatherings and people not, following public health guidelines. So that's been interesting when we've been helping intercept and trying to support landlords to maintain their units, and also to help individuals who might be living in their apartments retain their housing, because it's so important, obviously. It's been, as we've said, it's been extremely difficult for many individuals to adhere and understand the public health measures. And having that reduced access to usual consistent spaces and supports, things like the mall, places where I feel safe going to get a shower, or a community center, a library, common spaces have all been closed and disrupted there for a period of time, even as much as coming to our lobby and touching down with one of our staff. But I'll get to that in a little while, of how we address some of that when people did come to our space. It's already added stress to people who have a very stressful lifestyle as it is. We've worked with many individuals who were being, released from federal and provincial justice institutions, needing immediate housing. We've had people come during the pandemic, ring our doorbell out front and say, I literally just got off the DRL, or I just left HMP. I have nowhere to go. I need help calling the emergency shelter line. I might have been exposed to COVID, on the trek getting here. So helping people get the supports and services they need, and, reducing risk and helping people with, reducing the risk of reoffending, obviously, and overall community safety. But one of the struggles we certainly saw was, just not having that access to community spaces. One thing I didn't mention at the beginning when I gave you an overview of our organization is our beloved Stella Circle Inclusion Choir, which I've been a member of for a long time. We moved to virtual choir. Never knew that was possible, but we did. And it was so interesting. And the feedback we received from people I never thought would log into a virtual choir meeting. It was just astounding to see people saying, you know what, that's the first time I saw so-and-so's face in months or weeks since this all started. And I'm so grateful. It's been so uplifting. And during those kind of, times at choir, it wasn't always about choir. It was always sometimes checking in with folks and asking how they're doing, what they might need, doing meal drop-offs, that sort of thing. So really saw, people just feeling extremely fragile and vulnerable during that time. And certainly we saw a lot of folks who had very limited access to technology. We all would, probably most of us on here now would wait for that 2 o'clock update with the health, team to hear what's going on, because things were changing so quickly. Well, imagine if someone is homeless and don't have that reliable means to acquire the most up-to-date, information. Virtual stuff has not always worked for people. It wasn't seamless, especially when I'm having a housing crisis. What's going on in the news might not be a priority at this very moment. I need somewhere to go. And we know that you can align yourself and adhere to public health orders when you have somewhere to go, where you're going to eat that evening, where you're going to get your shower, where you're going to feel safe. So how many times did people say to us, everybody's saying stay home. Well, how do you stay home when you have no home? And home might not be safe, and it might not be that straightforward or that easy. And I just find that so incredibly powerful, at that statement. And we know folks who just would stop by and check in and say, like, what are the number of cases today? Well, how, what are they telling you? What are they saying today? Where is there any, what level are we in? We had so much of that. And I know certainly Christine and Naomi Centre received a lot of outreach and a lot of calls of that nature as well. But I'm going to tell you a little later about some of the ways we tackled some of those barriers around accessing public health information and technology and social media access. There were some very unique strategies we implemented to help people gain access to that information.
As we alluded throughout the presentation, folks who were experiencing homelessness were at increased vulnerability to COVID because of some of how they operated access supports. Their ability to follow the public health guides, and even, as Melanie just alluded to even know the public health guidelines if they don't have access to the information, was really challenged. Some folks don't know where they're showering, or they have their own hygiene issues, things going on themselves. So if the public spaces where they would typically shower have been now shut down and they're not able to access, their ability to follow those guidelines and practice the hygiene and the hand washing, and even the mask wearing. Access to masks were an issue for some, but the community were able to rally around, and there was big groups of people making masks and donating masks and giving out masks to vulnerable populations. But even with access to the masking, it was really challenging for some folks to be wearing the masks. Sometimes there was communication difficulties. Sometimes it was a result of mental health or physical health limitations. So their ability for folks and the persons who are experiencing homelessness or precariously housed, their ability was really impacted because of the circumstances they were in. Also, too, what we know about the homelessness community is that they have their own system and way of supporting themselves, and to expect them to socially isolate isn't something that they could necessarily do when they rely on each other for getting those social needs met, for safety, for being able to get sometimes their basic needs met. So while we were telling people to isolate, people's ability to isolate was impacted because of their need to have these social connections. Many of us were really disconnected from our families and friends. But as Melanie alluded to, we had our own homes and different resources we could kind of rely on. But folks who, to get their basic Maslow hierarchy needs, really have created a community within themselves to support around safety and getting those basic needs met. And COVID really interrupted their access and their ability to do that, but also their ability to isolate. And we alluded to the underlying health issues. As we've seen in the news, COVID-19, if you have other health complications, has impacted folks differently. For folks that are seamlessly otherwise healthy, COVID has been not as I guess, deathly to folks, to make it lightly. But what we saw was people with various underlying conditions. As Melanie alluded to earlier, we see a lot of folks with COPD, with different lung and breathing issues that they're struggling with, asthma, different types of autoimmune compromised systems and whatnot. And those issues also increase their risk around COVID-19, because it not only were they higher risk of getting exposed to it, but when they did get exposed, they were at higher risk for more, I guess, worse health outcomes. And the shared housing arrangements were also really lifted up during COVID-19 and increased vulnerability. A lot of the people who Melanie and I work with are on very limited, low fixed incomes. So what they're able to afford in terms of a housing option often is shared arrangements or conjugal settings. So their ability to kind of keep themselves safe in those arrangements, as we know, we can control what we do, but we can't control what others do around us. So there was a lot of concerns for folks who were, I guess, immune compromised or had other health issues, or who were just concerned about COVID and their ability to protect themselves in those shared arrangements, and even within the shelter system, because it is a conjugal setting place. Also, our ability to identify those early warning signs of COVID-19. Some of the women here at the shelter, when we talk to them about their symptoms or what we're seeing, they wake up every day with a cough and a stuffy nose. Or they live with chronic pain, or some of the women here are living with addictions and substance use disorders. So sometimes what we're seeing as symptoms was actually symptoms of withdrawal. So really trying to figure out what was happening for folks and working with people to kind of figure out what could be COVID or what could be just a symptom because of other things that are going on was difficult for folks. And they were also concerned because when they had symptoms, they wanted to kind of get it addressed. So getting access to the testing so that they could ensure that the symptoms they were experiencing were not COVID. The safety risk, I've already kind of highlighted this, the underground traditional work. It really, here at Naomi, we saw an increase of like unsafe working conditions that people were willing to engage with. It really increased the risk of exploitation and the exploitive stuff that can happen around work. And I kind of already alluded to this as well, when people were really struggling and torn about weighing out the risk of sheltering in place or staying in their precarious housing arrangement. So like the choice was not, while they did have a choice of where they could probably go, the choice was really not really a choice. Either choice was not a good option. So they're really having to weigh out those options and do their own risk management and risk analysis of where the best option would be for them. And staff certainly helped folks talk those things out and create safety plans and work with them to kind of stay in a place that was where they were most comfortable and that they felt that their needs could be best met. But as Melanie had mentioned earlier, the increase for violence and the interactions and tensions in those arrangements often at some point came to a breaking point for folks, and they had to make different decisions. So while we did make safety plans with folks and help people figure out from a harm reduction perspective where is the best to either to shelter in place or to possibly look for other shared arrangements within the shelter system, we really help people do that because that could change from day to day and week to week and hour to hour for some people, because the environments they were living in were able to shift as well, and the tension depended on who was there and how people were kind of reacting to the pressure, the intense pressure of COVID and lockdown and things that were happening. Initially, from like the shelter system perspective, the first couple of months, we did see a decline in the people who are actually accessing shelter. And that kind of goes to, for us, it was around people really worried about coming into even if they were in a housing arrangement that wasn't ideal, maybe there was less people there. They had different controls in place. So we did see people for the first little bit of the pandemic, when we were all kind of just trying to figure out what was happening, trying to shelter in place. But since that, we've seen a steady increase, and I think that can be, and from what people who are coming into shelter are telling us, the increase of violence that was happening, the deterioration of mental health that was happening for the folks they were living with, the substance use. I mean, we saw this across Canada across all socioeconomic statuses where substance use was reported on increasing, but specifically when folks didn't have other skills or strategies or supports to rely on. Sometimes substance was their choice, and with that increased substance use also bring a boiler effect for other people who were sharing that space, and creating different risk factors. So we did see a steady increase of folks coming into the shelter system, and the shelter system has been at high capacity for the most of COVID for a two-part reason. People were coming in, but we also saw an impact on the flow of people coming out of shelter. So the availability of the rentals and the people being able to transition from shelter into their own house or an apartment or even a bed sitter for that matter, we definitely see in the housing market tighten up here, specifically in St. John's. And I know that's been reported across the rest of Canada as well. So that really ended up putting more pressure on the shelter system because folks were ending up staying longer in shelter because the flow out of shelter was also impacted because of the housing crunch and things that were going on as a result of COVID, and the housing market. And we also seen people who never accessed shelter come into shelter before. Some of the transitions from folks who were working onto the CERB or on income support onto CERB impacted their housing. Sorry, I just had a little tickle there. So folks who are on income support can often have direct payments go to landlords to like light and power and those type of things. But some people who were on income support were also eligible for CERB. And when they accessed CERB and their income support shifted, those direct payments to landlords and heat and light were no longer happening. And if they didn't have the ability to do that on their own, sometimes they were ending up in rental arrears or power arrears, and that was impacting them coming into the whole housing and homelessness or the homelessness sector.
Great, thanks, Christina. Certainly in our roles here, working on the front lines of housing, and from a drop-in housing outreach perspective, in-reach outreach, we have seen just a significant increase in demand for services. Often when people come into the center, it's never just housing. They've also had, as Christina mentioned, disruptions in their income, in their employment status. Transportation has been a humongous one, especially for individuals who were transitioning, receiving CERB and had their income support benefits, terminated. As a result, they might have lost their bus pass. And having said that, bus pass or not, the Metro bus system was obviously very limited as well in terms of the number of people who could get on the bus at once. We had a lot of requests for transportation to apartment viewings or even, getting to another service provider or shelter. So that was very challenging. And as Christina mentioned, there were a lot of people who did apply to CERB, and whilst income increased temporarily, it did unfortunately end up in people experiencing a lot of evictions and having utilities cut off. We had a lot of landlords reach out to us to ask, I want to show my apartment to so-and-so, but, we don't want to do this in person. So how can your team help us facilitate that? Because I really want to house your participant, but I also need to keep myself and my family safe. So how do we do that? It's been an extremely uncertain and challenging housing market. And I say that now more so than what it was a year ago. In the year of 2021, I reported some statistics in January. Our housing team actually housed 105 individuals in the year 2021, which I think is pretty remarkable and outstanding given it was a pandemic year. So you may ask, well, how did you do that? How did you house 105 individuals who have, a lot of stuff going on that might, have impacted their ability to find housing? We have worked very closely with Newfoundland Labrador Housing around the rent supplement program. And now we have the Canada Newfoundland Housing Benefit. We've worked very closely with our colleagues at Eastern Health around rolling out mental health and addictions housing subsidies and top-ups. We've also worked closely with End Homelessness St. John's regarding their supported referrals. That's been so extremely impactful in terms of addressing people coming in saying, I need help with moving expenses. I need help paying for that additional damage deposit. So for instance, if somebody has a intent to rent in hand and they want to move on that because there's probably a lineup at that apartment for 21 other people looking for that place. Believe me, we've seen it. We've went to apartment viewings this past year where there's actually been a lineup outside. So landlords, are then in a position, and they're often reaching out to people like us to say, oh gosh, I don't want to deal with this influx of calls and responding to ads. Can you help us with that? So we've been able to advocate to other income sources under like supported referrals, for instance. So if somebody's damage deposit is $600, income support will pay that $372, and then we'll go and advocate for that outstanding amount of $228, which has been very common and certainly has helped people exit shelter and get into more long-term stable housing. We also help many people with just utility cutoff notices. I cannot say how many because there's been so many, my goodness, people who've had their power cut off. And what that means, not everyone might not know this, but if you get your electricity, your power cut, that actually is an immediate eviction from your landlord. So the landlord has a right to serve you a notice immediately to vacate their unit. So we've worked so closely with landlords to help turn people's power back on because, there's so much going on, the landscape of the community during a pandemic. We want to keep people in their homes. I can't begin to tell you how many requests we've had for service around social isolation, grief, loss, folks who had, struggles with, their past traumas, PTSD, the loneliness and isolation and uncertainty. And, the fear, of course, has been extremely impactful for people. And, our team has done so much in terms of phone calls and doorstep visits, that sort of thing. We've also helped people, get to COVID testing, and we've had a lot of people, and I know Christina could attest to this because she worked on the shelter line, people who live in St. John's wanting to get back to rural. And we've had, again, disruptions in bus services and requests for transportation. So what has that all looked like for people like us on the front lines, and how have we responded? Well, I can't help but beam with pride and get a little excited when I get to this slide because I'm just so incredibly proud. I speak with immense pride for the team. Certainly I provide leadership to, and our nimble response here. but not just our housing team, but our organization across the board. I shiver to think about things we've done and how far we've come. We didn't close one day here at Stella Circle. We remained open. We did not shut our doors. There were a couple of those early days in March where, we split up the team and some people stayed in the office and some of us stayed home. That was very short-lived, I will say, because we quickly learned this job really is very difficult to do at home. You have people who need housing. That's very difficult to do from your kitchen table. It can be done, but it's hard. We remained open. I want to talk to you a little bit about our welcome window. So we, of course, were very limited in how many people we were able to allow to come into our lobby due to social distancing, physical distancing. So we were sitting in a staff meeting one day on Zoom. And we said, my gosh, how are we set up here? Like, what can we do? Well, we opened up the window in our boardroom. And we made it like a drive-through. So people walked up to our window, right? They rang the bell on our front door. And we began meeting with them through the window. We went and purchased a cordless phone, which we would pass out to people and sanitize if they wanted to make calls. We arranged, virtual apartment viewings. I stood in the window one day with a gentleman and his landlord, and we negotiated the whole apartment viewing through the window. I laugh and I cry all at once because it was like amazing, like here we are. Like, what is this? We're in a window doing an apartment viewing. We passed out so many meals through that window. Not only through the window, but certainly through the doorstep visits as well. But we belovedly called our window the welcome window. We still call it that. And you want to know something? People still walk up to that window, even though they can come inside our lobby. We'll still get knocks on the window to say, you know what, I'm not ready to come in yet, but can you come talk to me at the window? When I got here this morning, there was somebody at the window. And that is okay. If that makes you feel safe, that's perfectly fine. I've passed out PPE to people through the window. I've passed out forms to get signed. I've collected rent for tenants who live in our housing. It's just been incredible. Our Hungry Heart Cafe has a program called Meal Squared, in which the catering team do up pre-packaged, nutritious, beautiful meals in takeaway containers. And if, patrons of the cafe can donate or round up their bill, and that goes towards our Meal Squared. Well, we kept our refrigerator and our freezer stocked, and it's stocked there again today. We passed out so many meals to individuals, which they could easily heat up. One thing we found here, certainly in the 79 tenants we support, we would say, not only were we dropping off a meal, but it was an opportunity as well to socially engage with people and to meet you at your door. How are things going? It was an opportunity for us to get eyes and ears on the apartment, because, we work with a lot of people who do have great difficulty maintaining their apartment and, cleaning and so on. So it was also like twofold. We get to see how you're doing, and we also get to see how your apartment's doing. We also had this was posted on our social media last week, and I encourage everyone to check out our social media platforms. We have a vibrant, active socials, Twitter, Instagram, and Facebook. We have had a very generous partnership with Little Caesars Pizza, a couple of locations where we've been able to pick up pizzas and give them out to tenants. That's been incredible. So, when I come to visit you, I'm going to have a pizza with me today too. And people have just been extremely grateful. And that's not just our tenants. That's anybody who's dropped in. If we think there's a food security response required, we will help you get that. We will make calls to the Food First NL line. We will do all that kind of thing. We've also, we hosted a non-symptomatic voluntary COVID testing clinic here last year. The uptake was incredible. We had many people show up who were, non-symptomatic, obviously, but came and had a COVID test by the nurses. We also, this winter, hosted a vaccine clinic here in-house in our multi-purpose room. The nurses from the harm reduction team came and provided vaccines and met with people, and it was so nice. Shout out to our Eastern Health partners. It wasn't just the vaccine. They were meeting with people around, how are you doing? How is your health? And we were just so incredibly grateful for that. We provided a lot of PPE. We had some very generous donations. We put out a few calls on our social media, and we had one donor came in with a big donation of cloth reusable masks, and really funky, nice masks. And oh my goodness, how many times did I go to the window and people would say, I would love some of those masks. I can wash them out and use them again. That's fantastic. We provided a lot of education, what I mentioned earlier around like just the COVID, the public health measures, updating people, countless Zoom meetings. Oh my gosh, so much Zoom, so much WhatsApp, so many case conferences. We worked very closely, I mentioned this already, just with End Homelessness St. John's through their Reaching Home funds around the supported referrals and helping people get on to housing-focused caseloads. One thing I want to lift up is we're delivering a program here at the Brian Martin Housing Resource Center, housing-focused case management. So we have 2 case managers who are assigned to work with people who are in shelter only. So people who are homeless, who are going to need a coordinated, probably more intensive long-term support. And we are in the process now of, given there's so much demand and we're hiring a 3rd housing-focused case manager to meet the demand, certainly, of shelter. We accessed many rent supplements from Newfoundland Labrador Housing and Eastern Health, as I mentioned, to help people exit shelter and get to housing. But we also, as I said, saw so many solutions that we will use beyond the pandemic, such as virtual, such as the way we work with people, our landlords, the drop-in services. Our efforts remain around recruiting new landlords. Landlords are so important to housing individuals. Yes, we have 79 units. Turnover has been very low given the demand, and certainly a lot of people wanting to stay put in their housing during the pandemic. We also balanced working with, just if I could speak to just, the importance of taking care of your teams and your staff. And I'm sure a lot of us here on this call, we've all had our share of, family responsibilities, challenges, that balance, childcare, all those ongoing things. So just, really taking care of each other here and working together, being creative. There were some of us who did not have, access to certain technologies that we have now. Some of us in the organization were trained in therapy assistance online, where we could do virtual counseling with individuals. And I know some of our participants have said, that is fantastic. Like, I want to keep doing that past this pandemic. So yes, as I say, I beam with pride just to see our response, our nimble, creative, innovative collaborations. I know Christina, Naomi Centre as well. I know there's a lot of women who've come to, who might not be a current resident of Naomi Centre, but certainly a former resident, dropping by to get some prepackaged meals and PPE and that sort of thing. So we've definitely had a good response in that way.
So just back over to me, really just bringing the response and putting it into theory for us. I guess when we were starting to do this work here at Naomi Centre and in the housing and homelessness, housing first is really a harm reduction approach, and harm reduction is really at the core of the work. And so I think that put us in a leg up when we were dealing with a virus like COVID-19, because it did really require a harm reduction approach in terms of how not only did we support the individuals we were working with, but how do we help the community in containing the virus and do our part in that way. So harm reduction was really at the core of the work. It wasn't on, harm reduction doesn't focus on eliminating harms, it really focuses on containing them. And it was really client-centered, not on focused on what was going on, but really focused on harms and to the individual and that type of thing. Trauma-informed practice was also that lens was also really important in the work we were doing. As we alluded to earlier, one of the pathways into homelessness is around some of the system stuff that's going on, and some of people's experiences with either the healthcare system or different social systems in general. So creating trust, safety, and choice was really, really important on those trauma-informed perspectives, and really understanding the diverse needs of, from a gendered lens, also from the cultural and historical lens, why folks maybe from different backgrounds were having different struggles in reducing harms or following protocols around keeping safe and the public health measures. Housing first, I guess, is a focus our community has been practicing from a housing lens for a long time. And that really, as we kind of highlighted and lifted up throughout this presentation, without a home, how do you shelter in place? And how do you do the other things that you need to do? What we know is some people who come into shelter are able to stay employed and engage in services, but coming into the shelter system really impacts people's ability to even engage in the daily activities that they were doing before they came into shelter. And what we know is a stable housing environment is the recipe and one of the key ingredients to folks being able to work on mental health, employment, the other goals that they may have. Because if you don't know where you're staying or showering or where you're getting your basic needs met, how are you kind of focusing on those other things and those other goals that you might have? And really drawing on people's strengths. The work we do with folks here at Stella Circle, they've survived and thrived well before us. So really building on the things that have worked for them in the past, using their strengths, using their innovative social connections to kind of using those, I guess, natural networks and the things that they do have in their toolbox to kind of as tools that we could use to help them with this new response, and how do we kind of navigate this new world as we're trying to all kind of work within this COVID-19 lens, and also trying to get the needs met of the vulnerable population. So these, I guess, 4 theories were really the key to us in the work we were doing, and they all are really interconnected and share some really common, I guess, themes around being very client focused, and the importance of collaboration and client choice and really meeting people from where they are. And I think that that's one really great thing we've been able to do, not only at Naomi Centre, but through all the different programs within Stella Circle, is really meeting people where they are and providing them information and opportunities so that they can make the decisions and choices that they feel that they need to make at that time that best meets their needs. And that was very important during a COVID-19 response. As we have highlighted throughout the presentation, the expectations that public health and the community had on vulnerable populations, their ability to even if they had, it wasn't about will or want, it's about their ability to do that based on what was going on and their current circumstances and how they had to kind of navigate the world and their different support networks because of either precarious housing or housing stability where they were ended up in a shelter system. So really important, the housing focus response. And as Melanie said, like the need for housing focus, case management and a response has been really lifted up, and it has increased as we are coming out of the pandemic. So really looking at how do we keep people housed where they are, not only supporting people in the shelter system, but supporting people before they come in the shelter system, as Melanie, our team, does so greatly up with Brian Martin from an eviction prevention, and even here at Naomi with our formers. How do we help the people who are already housed stay where they are and not come into the housing system? And even if where they are isn't their ideal and there's issues there, how do we help them manage what's going on and also simultaneously help them move on to a different housing arrangement, which without creating a huge disruption? Because as we know, coming into the homeless system is a trauma in and of itself. the lack of control, the rules that people had to follow, that not being able to do things and access things the way they would previous to coming into shelter. Like all those things are very traumatic for folks, and not even knowing, like, how do you think about what you're going to do tomorrow if you don't know about where you're going to eat, or if you're even safe today, or what the risk of you contracting COVID is because you're immune compromised and you have COPD, those type of things. So one of the things, I guess, the key takeaways, and I think our community has been working on this for a long time from a housing-focused, housing-first perspective, but really focusing on helping people secure permanent, safe, affordable housing. And we are very challenged within our current housing market to do that because there's such a housing crunch. But how do we kind of work where we are and support people to have stable housing that they're able to do other things from? Because what we know is it's not just about the housing. Housing is a key component, but also attaching some supports on the other end so that people are able to maintain that housing, whether that's through rent subsidies or redirect payments or doing some landlord mediation, as Melanie's team and our team here does as well from time to time. But housing is a key determinant to health, and I think that the pandemic really lifted that out because sometimes that can be shadowed by the other things when we think about it from a health perspective.
Just to kind of clue us up here, we're at the last slide here now. What we've learned so much, as you might have got from this presentation. Something that really stands out is how important it is to incorporate and involve the voices and perspectives of the service users themselves, and how valuable that perspective is as well when you incorporate those frontline staff members who've been really immersed in this, in doing this work during the pandemic. Vulnerable community members, especially, individuals experiencing homelessness, are often excluded from planning and service planning, that sort of thing. So there are so many solutions that we can use beyond a pandemic world. For us, certainly, we've learned that we are very strong when we're all together and when we're, collaborating. I could list off so many agencies that we work so closely with, community partners, funders, that we met with regularly. Everybody wanted to maintain communication. There was no doubt about that. Communication was key. Multiple case conferences and case consults, planning, everybody willing to share their resources and knowledge and best practices, and also willing to, change or, modify what we're doing if it meant service delivery could improve and it's, had positive impacts for the participants we serve. This did not come with any precedent or rule book or guidebook. So we really had to rely on each other. Many of us, we did a lot of webinars and training. We used our time in other ways as well to learn about across Canada what are some of the practices, what are our friends out in Victoria, BC doing. Some of us had the chance to attend the Canadian Alliance to End Homelessness virtual national conference. Lots of great things from there. We embedded self-care practices however we could. Our office is located very closely to Bannerman Park. How many times did we go around to each other's desk and say, come on, it's coffee and park time now. Let's split ourselves up and, we'll go for a walk, or, take that little bit of extra time to get some fresh air, check in with your family, check in with whoever you need to, check in with yourself. Our team, we stuck together. We knew it was a challenging time. It wasn't just a scary time for the folks we serve. It's a scary time for all of us. So having that consistent check-in and that kind of innovative collaboration, if you will, was so incredibly imperative. So as we wrap up, as I mentioned earlier, I would certainly encourage you to visit our socials, as you can see there. If you have any questions about our housing services, or certainly any program of Stella Circle or anything housing related, certainly don't hesitate. Some of you I talk to regularly anyway, so please reach out. Happy to share our knowledge and resources with you all. Thank you.
Wonderful. Thank you so much, Melanie and Christina. This was an excellent, excellent presentation. We do have some time for questions. We had a couple that came in. So someone is wondering, do individuals requesting housing through Stella Circle have to be involved in other program areas to access services?
Absolutely not. We have kind of a no wrong door referral process. Anybody can access our resource center and our services and can drop by. The best way to access our housing services is to drop by the resource center, and you can drop in anytime. We always have staff available. We had a couple of walk-ins when I arrived here at 8:15. There was a few walk-ins waiting. We have housing help every day, Monday through Friday. What we've come to learn over the years is foot traffic is most heavy in the afternoon. So what we've decided to do is make sure we always have staff available in the afternoon, in particular. So do your home visits and your kind of other administrative duties in the morning. And then we've really tried to make ourselves, we split up the team so people can respond, and the lobby can get pretty busy. So certainly if you have any questions, like call and ask for me, and I'd be happy to redirect.
Okay, wonderful. Thank you. Our next question is around how might we address housing challenges for those who maybe are not able to avail of shelter services? So, for example, due to violent behavior, is there anything that we can be doing to help those individuals find housing?
So folks can go down to the Brian Martin Housing Resource Center. That's a really great starting place for folks in terms of being able to do housing searches, get connected to see where landlords are. Sometimes there's some advocacy that folks can do around shelter to see what shelter options may be available to a person. But really working with the community to see what is available if they're not able to access the shelter system, to get those shelter needs met. Sometimes folks who aren't able to access the shelter system are able to access some funding from income support to stay with family or friends, or sometimes that will bridge them for a period of time while we're trying to get some other type of housing arrangements. But it is a challenge when folks aren't able to access shelter, and we're trying to work with them. So I would recommend connecting with Melanie's team down there. If they're young women who are formers to Naomi or meet our mandate, connecting down here as well. We can help support and navigate the housing and homeless system. I think one of the really cool things about the Real Homes program is that they really do have their fingers on the pulse of what's happening in the housing and homeless world. So if at any point that people are being excluded from systems or whatnot, they might have other experiences with that. Because I know Melanie and her team have had many people in our lobby that they weren't able to access for various reasons shelter, and they've been innovative in trying to kind of support people where they are and doing the best with what we can with the resources we have available to us.
Mm-hmm. Wonderful, thank you. So we do still have some time, so if there's a couple more questions that people want to ask, feel free to send those in. But just another question that we have is in terms of what you saw as the biggest challenge from your perspective at the beginning of the pandemic from a local context. So when the pandemic actually first started, what were some of the biggest challenge that you saw?
Certainly it was the unknowns. The unknowns were a huge challenge of how many times were we asked, like, how long is this supposed to go on for? Or, when do you think such and such an organization, might be able to, open up again? people wanting some assurances around, like, my housing is stable, like, is my, if they're, living in our housing, can I, I can stay. Our housing is long-term housing, our 79 units, you can come and stay forever. So people just saying, I'm planning to, stay put, and, this is the kind of what my supports will need to look like while I live here. Again, the demand of people living in shelter. We saw so many service requests for, I don't feel like I want to, I want to have my own place, as Christina said, to isolate and to be able to adhere, to the guidelines. But, I'm doing the best I can, and the staff are fantastic, which we know they are. But as we know, having my own, so really working from that housing first approach was imperative, and it guided every decision, every move we made, essentially.
Annette, I think you were muted when you had that. You were giving us the next question.
Oh, sorry. Sorry, yes, I was. Thank you. So our next question that came in is in terms of, will there be a coordinated access approach moving forward?
Well, currently there is already a coordinated access approach that has been implemented prior to COVID-19. It's shifted in various forms, but there's been a coordinated access approach in the community for some time now. And there continues to be a coordinated effort in terms of supporting people flowing from shelter and doing that shelter diversion work. So there currently is a coordinated access, and Homesslessness St. John's kind of oversees that coordination. They also have a website and information as well if you're interested in seeing what their role in that is. But weekly there's a meeting that happens through coordinated access on Wednesdays, where lots of folks in the housing and homelessness system are a part of the shelter programs, and any of the workers or different community agencies who would have workers that are that housing post case management.
Mm-hmm. Okay, wonderful. Thank you. So we had lots of comments coming in about how great they found, the participants found the presentation. But I guess we'll end with one last question. In terms of, now that the pandemic is shifting more into the endemic phases, what impact has this had on the housing and homelessness system locally?
Well, as I mentioned earlier, we're in a very challenging, uncertain housing market right now. And anybody who might be on this webinar right now who works in any form or capacity of housing will be able to certainly attest that vacancies are extremely low right now in the private market. It's a strange time because we appear to have resources that might not have been, we are accessing more subsidies, and thank you to the Canada Newfoundland Rent Supplement Benefit and our mental health and addictions folks at Eastern Health, where we're availing of subsidies. But a major obstacle right now is actually finding apartments, finding a landlord, and finding vacancies. And as I mentioned earlier, we're going to apartment viewings, and there's lineups, and you need to have funds in hand often, which is like a real struggle. You want to have your damage deposit and sometimes your first month's rent. And landlords, we're seeing a lot of properties, and I'm hearing this a lot from our landlords we work with, folks who live outside of the province buying up properties in Newfoundland, and not necessarily making them rental properties either. So it's been I hope this is just a little phase, and we're going to see, because certainly I've been here 13 years, and I've seen the housing market, the private housing market, go up and down and shift in every which way. But we're very grateful for the financial resources that are at our disposal. But we know right now the efforts also need to be focused on recruiting landlords, supporting landlords, and finding more properties to rent.
Mm-hmm. Okay, wonderful. Thank you so much. So that brings us to the end of our presentation this morning. And just to kind of wrap things up, I want to say a sincere thank you to Melanie and Christina for this stellar presentation and for sharing their knowledge, experience, and expertise with us today and highlighting the impact that COVID-19 has had on those who experience homelessness and the services and supports that were integral to helping people through this pandemic, but also the work that will continue. And as a profession, social workers provide critical and essential services to enhance the health and well-being of individuals, families, groups, and communities. And this work is certainly reflected in the theme for Social Work Month, which is in critical demand. Social work is essential. And it's also reflected in the work of Stella Circle through their many programs and supports. Melanie and Christina, your passion for this work is inspirational, and I truly appreciate you both taking your time this morning to facilitate this webinar for us. Just want to note that the PDF of the PowerPoint presentation is available on the handout section of the webinar platform, and RSWs may claim 1.5 required CPE credits for attending this webinar as per the NLCSW CPE policy. And as you begin to sign off, we also ask that you complete the evaluation that will appear on your screen. Your feedback is always so greatly appreciated, so we welcome that. And on that note, I just want to say thanks again, everyone, for attending. Thank you again to Melanie and Christina. I hope everyone enjoys the rest of their day and the rest of the Social Work Month celebrations. Thank you, everyone.
Thank you.